Again, Michael Wong, Harrisburg Redevelopment Housing Authority. Vine?
Hi everyone, Vine Adoe, Western Virginia Continuum of Care Coordinator under HRHA.
Zanetta?
Zanata Finn from AIDS Response Effort.
Sherry?
Good morning. I'm Sherry from Housing Choice Voucher Program.
And I'm Sherry Erie from Family Promise of Shenandoah County.
We got two Sherrys. I'm
Two
sorry. I had
Sherrys.
to
I'm
clarify
sorry
that.
if I was wrong, Sherry.
No, it's fine. Danielle?
I'm Danielle with Volunteers of America with the SSVF program.
Great. Rachel, welcome.
Hi, I'm Rachel Hunley, the new housing coordinator for Harrisonburg Community Health Center's Care Management Program.
We are happy you were able to join us today.
Thank you.
Deborah, good to see you.
I'm Deborah Bonds. I work with laundries and showers at Asbury United Methodist Church. And I feed the homeless on Saturday mornings.
I imagine they get fed very well that day. Deborah used to run the National Visual Tax Center food kitchen, so she is an expert culinary person. Kate and Sheila?
Who? I'm sorry, we didn't hear who.
You two, Kate and Sheila, you want to introduce yourselves?
Sheila. Yes, I'm Sheila Orndorff, Shenandoah Alliance for Shelter. I'm Katie Ferguson, also with the Shenandoah Alliance for Shelter.
Thank you all. Miranda?
Hi, I'm Miranda Hulse, First Step in Harrisonburg. Can you hear me?
Yes.
Okay.
Great. Thank you. Christopher? Chris?
Good morning.
Hey, this is Chris Monroe from Northwestern.
Thank you, Chris. Nikki?
Hi, this is Nikki Fadley with Strengthen Peers.
Debbie?
Debbie Dart with Choices, Council on Domestic Violence for Page County.
I'm going to jump back up the squirrel. I feel like it's one of those connect the dot squirrel type of activities. How about the Mercy House group?
Shannon Porter with Mercy House.
Sally Perry.
Paul Rush with Mercy House.
Great seeing you guys. Let's see who else we have here. Elizabeth?
Hi, I'm Elizabeth Coltrane from Blue Ridge Legal Services, and I'm the housing law attorney.
Good seeing you, Elizabeth. Kim?
You too.
Hello, group. My name is Kim Wetzel, and I'm with HCHC Care Management.
Thanks, Kim. Debbie? Debbie Dart?
Oh, hi. I thought I already introduced myself. Debbie Dart with Choices, Council on Domestic Violence for Page County.
And with Debbie, I see Robin. Are you still on the line, Robin?
I am Robin Stevens with the Council on Domestic Violence for Page County.
And also Jacqueline from Choices, Council on Domestic Violence from Page County.
Great, thanks, Jacqueline. And I see that Kim's on the line. And Kim has, I don't know if y'all know, but Kim was hired as a new executive director of the Habitat for the Northern Shenandoah Valley area. Kim, you want to introduce yourselves?
Good morning, everyone. Kim Herbstritt, Executive Director, Blue Ridge Habitat for Humanity.
We are very happy that you're with us. Kim was a long-time CoC member when she was in another position, and so we're glad that she's back with us. Laura Semmel?
Hi, Michael. It's Lisa Herbaugh with the Laurel Center.
Great. Good to see you. We'll hear from you, Lisa. Dana? You want to introduce yourself? Hi, Dana. You want to introduce yourself?
I think that's Danny.
Oh, it's
Danny.
I'm Danielle from Northwestern.
Oh, okay. Hi, Danny.
Hello.
And Brandon, you want to say hi?
Sure. Hey guys, I'm Brandon with the Winchester Rescue Mission.
Great. Let me see. Who else have we have here? Katie?
Hi, it's Katie with ARE.
And with Andrea?
Good morning. My name is Andrea Wilson, and I am with People Incorporated of Virginia.
Oh, we're glad that you're with us for a discussion later on, Andrea. And Diane, I think that's the last person on the line.
Hi, Diane Whitwright, Case Manager, Family Promise.
Great. So we have a full group, and that's great to see everyone. And within the agenda that was sent out, I think last Friday, you all had a copy of the minutes. Are there any questions or changes to the minutes? If not, I'll entertain a motion for approval. Any edits or comments? Hearing none, would someone be willing to make a motion for approval?
I move that we accept the April minutes.
Do we have a second?
Second it.
And who was that? I'm sorry. Was that
Sheila? Sheila. Second.
Sheila? Okay, thank you. All in favor signify by saying aye.
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 Any opposed? All right, minutes pass. Vine had asked for the committee chairs to send out brief updates in regard to committee work during the last couple of months. And hopefully you all have received those. Thank you for all the committee chairs for being able to do that as much as possible. We thought it'd be easier to have you all have those minutes in advance, and then just ask that the chairs have, if they have anything else in addition that they want to add to the minutes, make comments so that we can move through this committee update pretty quickly. So with that being said, is there any additional comments from centralized intake from the notes that they've sent? Committee?
No.
All right. That was, I believe, Katie White, who's the chair of that. Best practices, I do not believe was able to get a committee report in. Is there any updates they want to provide?
No, I don't think they've met. We meet this month.
Yeah. Yeah, I don't think Lynn is on the line at this time, so we'll follow up with her later. Compliance and evaluation, any additional comments?
I don't have any. No.
Okay, great. I know that their big work's coming up with the CoC grant happening. Data and performance, any other comments?
Just a brief one. I received an email from Andrea the other day following up on the dashboard that they're working on statewide for HMIS data. And I'll be passing on some documents to the executive committee for review to have that move forward.
Thank you.
That's it.
That project's been going on for 2 years, so it'll be good to see if they get this dashboard up.
Yes.
Media advocacy, I don't see Oscar on the line, but I know that they're working on the brochure at this time. Is any other updates from the committee? Okay, Built for Zero. Any updates from that?
Yes, I would say both groups have been meeting, both of the local groups have been meeting consistently. I'll be sending out some communication today about a regional meeting. We haven't had one in a while, and with an influx of permanent supportive housing, we're hoping coming through HRCSB, we're going to need to discuss as a group and just really clarify our purpose with this Built for Zero case conferencing, get back on the same page. And so I'll be sending out those communications later today, so look for that.
Great. Executive committee. I was absent. I had another meeting that I had to attend. So would someone like to give an update from the last executive committee? Shannon, Sheila?
Yeah, we talked a fair bit, Michael, about trying to restructure the CoC in the coming year. We felt like we were very fortunate to have the opportunity to do as well as we did on the VHSP grant, and really wanted to look at how we approach the NOFA and where we've lost points in that scoring, and that there was going to be a desire to try to organize our committees along those lines to be able to reverse engineer that process, to put ourselves in a much better position to be viable for more federal funds going forward.
And hopefully the strategic planning process and our discussion later today will help us take those footsteps toward that goal. Anything additional, Sheila, you want to add and go to the meeting?
Just the importance of everyone taking a role setting on these committees. You know, we need to get back to monthly meetings and everyone taking a part in these meetings. Without committees, I don't see how we can get this work done. So it's extremely important that we have active committees and that are meeting monthly and doing the work that needs to be done in the next year. And most important, with the NOFA coming up, I know the Compliance and Evaluation Committee has already met just this week trying to get ready for that and have some procedures in place or make some recommendations to best practices and to the executive committee. So it's just extremely important that we all work together to do this.
Thank you. Any questions from anyone in regard to the committee work? I think we're speaking to the choir in regard to the importance of everyone being involved and participating in the process. So we just all need to kind of do what we can. I know that everyone is working very hard at this time just because of the additional funding that we received and trying to address all the challenges that we have in the pandemic. But the only way we can be able to address and be successful is by us working together. So with that being said, I want to recognize the grant writing team for VSHP 2022 funding. As you know, they've been working since February in regard to the grant application. We heard a couple of weeks ago that we received full funding in regard to our grant amount. We were in the top 2 in regard to the highest scoring in the Commonwealth in regard to our CoC for the state funding award. So kudos to all the grant writers and members and everyone that was involved in the process. It was truly was a team process to have that success. So send your appreciation to all those individuals that were involved, and Shannon, Sheila, Oscar, Emily, Vine, Laura, and then many of you all contributed in regard to your comments in regard to making the grant happen. So kudos. We got full funding in regard to all of our requests. First time ever that we received that. And it's critical that we maximize the use of it. As you know, with the pandemic and the COVID funding, the impact to the Housing Trust Fund is going to be significant in regard to future funding sources. The monies that we are receiving at this time is predominantly from the budget from last year. So we won't go into, for this upcoming budget, we anticipate a significant less monies in the trust fund. We have to really make sure that we utilize these funds to the best of its abilities. and maximize their impact. Again, I don't know what else to say about the funding process, but if anyone else wants to make any additional comments.
Well, I would just like to add that I appreciate you, Michael, including me, but most of the work was done with Shannon and Sally and them and Emily at Mercy House. And I'm so appreciative, and I'm not surprised that we were in the top 2. They do such a great job. So I think that we just need to thank them for their hard work that they put towards that, because that takes a lot of time and a lot of dedication.
Definitely.
I don't want to forget Oscar as well. Oscar took a significant portion of the grant and was involved in a lot of that writing as well. So kudos to Oscar. All's well that ends well.
Yep. Yeah, the hard part is now we get the money. We have to make something happen with it. That's always the good part. Okay, COVID funding. We, as you all know, we received about $139,000 in COVID funding in the initial round from DHCD. We also know that some of our community stakeholders received some, have been utilizing some of the FEMA funds to be able to stretch those monies around a little bit. When we received those $130,000, we recognize the importance, because these are emergency shelter funds, is to prioritize the thermal shelters in the Harrisonburg, Winchester, and Fort Worth, Warren County area. So $100,000 of that budget went to those respective agencies. Rescue Mission, Warren County Rescue, and then Open Doors in Harrisonburg. And I want to commend all those 3 shelters in regard to the work. They jumped on it. Brandon did an outstanding job in regard to coordinating and starting from scratch a thermal shelter. And I know that he has great stories to tell about it. Michelle Snetzel from Warren County did a similar type of activity. Their shelter was about way in, and the county came to them and asked for assistance and support to continue the shelter. And so they all continue in their shelter to the end of June. Brandon, the Rescue Mission, and Open Doors all ending their program the 9th, Wednesday, consistent with the governor's activity. And I think, you know, what Brandon did in the Winchester area, Kim Husband's on the line, and she was also involved in it, along with the Unite Way. There was really nothing going on in regard to what was going to happen after Watts closed. And Brandon jumped on the line. He took a lead. The Unite Way got in there. Kim brought the city involved. Brandon reached out to Shenandoah University, and within 2 or 3 days, they had this thermal shelter going. And within a week, they had it, they were occupying people in an incredible facility that was being unused. So Brandon, I just want to commend you in front of the group. I'm hoping that this is not the end of a partnership, but a beginning of a partnership. And definitely a way that we can work more closely, the CoC with the Winchester area, and also within the Warren County and Fort Worth area. It's been very positive in regard to having these COVID funds and developing this relationship.
Well, I could just jump in and say big thanks to you guys for helping us make it happen. It truly was a team effort. I think we are getting more credit than we deserve. It truly was a community opportunity. And so big thanks to everybody who helped make it happen. And our goal is, if we can make this happen more long-term, we are definitely down to do that.
Well, we may have some opportunities for you here in the future. Is Michelle on the line? I don't know if Michelle joined us today, but we did have a emergency shelter call with Northwestern was involved too. And we talked about next steps, and So everyone's really excited about how we can be able to kind of identify plans so that we can engage these communities and see how we can work together to address those local needs. And as I said earlier, we also talked about the component of hotel motel vouchers. I know that Sheila, Shannon, and I think A's Response is working on those types of activities. Do y'all want to give an update and go to how things are going? I know it's been a challenging process, and we got to keeping the hotels, motels working.
Yeah, Michael, we've got, as of today, 27 cases in the motels in Harrisonburg. We've probably, throughout the last 2 months, have probably served about 36, 37 households. We've had several that have left or dropped out for disciplinary reasons because there were arrests and other things that kept them from staying at the motel. We did have a couple people get placed into permanent housing, which is exactly where we would like that process to end up. We started out with seeking funds from our community foundation, and were able to receive a $25,000 grant from the community foundation to start our process. We initially started using Mercy House funding and that community foundation funding, and now we've been able to use the VHSP funding right behind it, which has been very helpful. Our sincere goal is to be able to try to get every single person that's currently in our motels into permanent housing, but we know it's going to be a daunting task.
Michael, I'll just report for the North. I think we have like 15 to 16 households still in hotels. We have been able to move all of them to permanent housing so far. And I say that we're extending weeks too to try to find permanent housing. You know, the funding's going very rapidly. You know, our goal is to get all of them permanently housed, just like Shannon said. I don't know if the funds are going to last long enough for us to do that. So we're still working on it. I was so happy to receive an email from DHCD with additional prevention money. So, and we utilize that immediately for, you know, this year's grant. So we're working on it, but you know, 50,000 sounds like a lot. When you start putting 15 to 20 households in a motel, like Shannon said, it goes very quickly.
Well, as you all know, Emily has sent out an email a couple of weeks ago and reinforced it about a week ago in regard to asking about what funding levels will we need to functionally end homelessness. And through that feedback, the CoC received $186,475 of COVID funding round 2. This is emergency shelter funding, very similar to the $139,000. So we will be having a executive committee meeting Monday to discuss priorities within the CoC in regard to use of these funds. Again, these are emergency shelter funds. So this, you know, again, it's the prioritization is again the thermal shelter types of approaches and the hotel motel. So exciting to get the notice of the funding, and we look forward to be able to issue this funding out. If any of the grantees here on the group see some ways that they can collaborate, partner to be able to use these funds as we move forward, please let us know, because we'll be working to be able to establish a process to figure out how to move this funding out.
Michael, do you know what that looks like in relation to the ask that each agency made? There was a request that was put out to each agency to put a proposal forward. Do we have a sense of what we asked for and what we ended up receiving?
No, I don't. We just got this notice from Will the other day, and so we have not had any follow-up or calls or direct discussion with them. We just got an email notice of the award.
Michael, so is this the funding that would run through December and then the second, there's another round after that yet? Because
I don't know if there's any other rounds after that.
Well, there was two time frames that we've needed to submit a request for. So when I submitted my request, it was a time frame for August through December, and then there was another time frame after that we put in an additional request after that from January through the following September. So I was just curious, this is just that first round, and is this just emergency shelter? Do we have any word on rapid rehousing or prevention?
Nothing about rapid rehousing prevention yet. They hope to be able to do an announcement on that very shortly. This is only shelter. And they called this the second round. They did not, so, and the funds have to be utilized by December. So I don't know which alignment that is. Since this is, I believe, still KILLS Act funding, they were also kind of planning out for the HERO funding. That was the House bill that had the $100 million for rental assistance and emergency funding. And that, as you know, is still caught up in the Senate. So that funding for that second phase has not been appropriated at this time. Other questions?
Michael, I just wanted to add, Shannon said it earlier, and Vine sent out an email this week asking, what additional funds we had in our community. For everyone on the line, we were fortunate enough to get $20,000 from our community foundation, and having these community dollars to supplement the emergency operation has been a lifesaver. So if you're sitting in a community and you haven't reached out to your foundation or things in your community that can help fund some of these things, I suggest that you do that, because it's the need is, we've had so many needs that the emergency funding did not cover. So if you can, utilize your resources in your community, it's a huge help to getting these people into permanent housing.
I would just add to that. I think definitely the local funding foundations, or even here in the Northern Shenandoah Valley, the United Way started a COVID-19 fund. And so there are different pots of money out there, but also want to just mention that the local governments are receiving CARES Act funding. And so I think that that's another really important place to have communications with your local government, because those funds have to be, just as the PPP and some of the other funds that have come down, are required to be spent in very specific ways. And so just want to make sure that people are tapping into all different pots of money that are out there, and to not forget your local government.
Kim, have you all had any luck with that funding in your community? Because I reached out to my local government, and the response I got back was, we did get the CARE Act money, but it's not open for application. So I wondered if you've tapped into that and what their response has been with your local government.
What I know is that they're at least for Winchester, they're in the midst of figuring out how it's all going to be divided, what it's going to be spent on. I know one of the big things here, and I'm sure, not a surprise to all of you, but is childcare. Childcare is a huge issue. If there's not childcare, people can't get back to work. And so again, there's specific ways that the funds can be used. And I know that Winchester is in the midst of looking at all those different options and identifying the needs specifically in the community here that would fit with what those funds can be used for. And I do think that there will be some support to nonprofits, and the specific details on how that all plays out or falls out, I think is still to be determined. But I would certainly be having conversations with your local elected officials to, I think a lot of times they just don't understand what the needs are, and how they could carve out a small or medium or whatever size funding to actually address some of the needs that would fit with the CARES Act requirements.
Mhm. Okay.
I've been in communication with the city quite a bit here lately, and they're using the CDBG money effectively as something within their own budget. It's not going to be put out for any kind of RFP or bid process for any other services. They are looking to possibly hold back a portion of that money to be able to try to assist with a thermal shelter if we can find a site for one going forward. And that seems to be their intention, but it will not be made available to the broader community.
Shannon, have you had communications about the CARES Act funding?
Yeah, at least the money that they've got in hand right now was appropriated through CARES Act in the form of a community block grant. There is other money coming, and I think it's like a $4.6 million allotment. And I have a sneaking suspicion based on my conversations with our city manager that those are going to be used to spackle as many holes in the city budget as possible that relates to any sort of services that would be impacted by COVID-19 within the framework of what they're allowed to do. But they did say that they are looking to hold back some funding to assist if we can find a place for a thermal shelter in the fall.
I would have been happy with that response, but that's not the response I got, Kim. They just really shut me down and said, it's not going to be open for application. That doesn't mean I'll give up, though.
Okay, I want to announce, I guess this is as good a place as any in regard to new business functional and in homelessness. There's a lot of concerns in regard to the eviction issue. As you all may have heard just the other day, the Supreme Court announced, the governor announced that the Supreme Court has extended the eviction period of time to the end of June, June 27th. 28th, thank you. With that being said, Department of Housing and Community Development is kicking off a built from the ground up and moving and building as trying to fly it, and rent and mortgage program. They are dedicating $20 million across the Commonwealth to not just address the eviction issue, but also to have stable housing and public health. And so the assistance is a short-term, medium-term assistance. They're looking for one agency out of the continuum of care to be the lead. You could be there could be sub-grantees, and that will probably be the model that we would recommend just because of the size of our CoC. The agencies can be a community action program, a nonprofit, local government, regional commission, and the funding will be on rent and mortgage assistance, housing relocation costs, and the administration costs. This is on a fast track. They want to have know who the grantees are by June 18th, next week. They want to be able to have a grant implementation guidelines. They were still in draft form as they showed it to us yesterday. Have them finalized by the 19th. Have budget agreements established by the 24th, and start the program on June 29th, the day after the notices get done. So, the idea was to have the funding be flexible, easy to access. The biggest priority is the people that are in a ways from the March to current. The three categories that they have listed at this time, again, this is not finalized, but those that have been affected, the job or economic condition has been affected by COVID-19, that there was a childcare issue where they cannot be able to return back to work because of COVID-19, or there is a issue in regard to a long-term health implication that restricts them from returning back to work for COVID-19. Right now, there is no, they have not set any guidelines in regard to economic standards. They looked at 80%. I recommend they go up to 150%, but they have not really released those at this time. So there is no real clear definition in regard to how much funding we will receive. The first step is kind of determine how we will be able to cover this within our CoC. So we'll be, this will be another issue within our executive committee meeting next Monday. And hopefully right after that meeting, we can be able to announce the process for how we will be able to let grantees for our CoC. I just want to take a deep breath because that's a big job and a big task, and it's a exciting opportunity, but it's also a tremendous amount of work in addition, above and beyond what we're doing. This is again not targeted just toward individuals that are homeless, but also for individuals that are affected by the COVID-19. So it'll be a broad range of individuals.
Michael, I'm a little concerned just because our meeting is next week, and if we have to have the grantees identified by the 18th, that gives us about a 3-day window. Is there any way we can maybe set something up sooner to talk?
I don't know. Maybe we can call and see. I unfortunately have a lot on my plate too, and today is Thursday. You know, Friday's tomorrow. I've got, you know, I'm just unfortunately I have all don't have much time, you know.
I understand. I just thought with Zoom we might have a shot at it, but I fully understand your plate being full.
Other thoughts, ideas, suggestions? Yeah, a time frame. I mean, we got the call yesterday at 1 o'clock, and so we're trying to get it out as quickly as possible. It's exciting but scary again, and I think DHC recognizes that all the grantees, everyone within the continuum care have been working extremely hard. We've had additional funding that we've tried to push out, addressing challenging needs within our community. We redesigning how we do work so that we can be able to continue to do the work that we need to do. So we probably all have what 2 or 3 times as hard, you know, these last couple of months in regard to trying to keep things moving forward. So it is something that we're going to have to take a breath and make sure that we want to do this well, because once the notice comes out, we're going to understand that the demand is going to be really high, and you know, the ability to be able to process and do the reimbursements is going to be extremely challenging for any organization to do.
Michael, one of my concerns is that we're also going to have to find a way to be able to handle this with the tremendous amount of volume that there's going to be coming forward for demand, but also to protect our core services and find some way to be able to handle that apparatus outside of our normal bounds of operations. I would be greatly concerned about overloading our centralized intake with people who are not homeless or even remotely close to homeless that are looking to seek these funds. And I think we have to really give some thought as to how we're going to work this process. And it may be more of a localized effort based on each community's response as opposed to a broader CoC network. That's just my initial thought.
I agree 100%. I was thinking that the application process is going to be outside of the CI process, just due to these individuals are really, they are not homeless yet. They are in a ways, but they have, you know, do not meet any of the homeless classifications of the standards that we have at this time. And so this is a lot broader and flexible. So it is, again, it's not going to be on normal grantees that we'll be looking to be able to move this forward with.
Michael, do you have a sense of what the budget's going to be?
It's $20 million for the state. They're going to start off with an initial $100,000 reimbursement, or to kind of help the agencies be able to move forward. But no, nothing else at this time. No clear limit in regard to And you think 100,000 is a lot of money, but really that could be if you have three family, 3 months in a way, so we go to rent, that can easily be $3,000. So you're talking 30 families across the CoC with $100,000.
Well, and I guess the hope would be that there's sufficient funding to really staff this. And hearing what others are saying, that they're staffing, you can only keep adding on top of things when things start to collapse. So hopefully they're recognizing that this is going to require some pretty dedicated, specific resources to kind of manage all of this. So I would hope that there would be enough funding in there to bring on resources to run this.
They did talk about a 10% administrative fee. So you think $100,000, $10,000, it's not enough to be able to fund a position, so you would almost have to do, $500,000 to be able to fund a position. So it's going to be challenging to be able to do. And then how are you going to fund a position? And the money's only supposed to be from now till December. So it's one of the things that we're going to be working through as we kind of set up the program and as we seek out grantees to be able to move it forward.
Michael, I was talking to DHCD yesterday, and the other concern with this funding coming forward that I know Shannon and I have talked about, and we've talked about it at the executive level, but is the capacity and the cash flow. Talking to Will yesterday, when they first gave out the emergency shelter operations and the FEMA funds, they looked at a 2-week reimbursement thing, which is really never happened. And he says it's going to even get slower. So, that's a big deal for a lot of us, to be able to fund all these things up front and waiting for the money. So the money goes really quickly, but if it's not going to come back even within 30 days or more, that could create a problem for a lot of us.
Really? Definitely. We all understand that.
Yeah.
Any other comments? Again, some of the benefits of getting awards and resources is figuring out how to make it happen and the challenge associated with that. Okay. Feel tired after all that discussion and where are we going from here? But Fine has sent up with the agenda the strategic plan that we had developed, hard to believe, almost 2 years ago, 2.5 years ago, which outlined kind of the steps that we've been following along the last couple of years. As Shannon talked about, within the executive committee, one of the activities we wanted to do today was look at that plan and then also look at the feedback that we got from the federal NOFA grant this last year, and also the feedback that we got from the debriefing that we had through the state grant, the VHSP grant, and we go to next steps and what we have to do. I don't know who has a cuter background, Elizabeth or Chris. Chris with his dog in the back, or Elizabeth with her son in the lap. But both of those are pretty impressive backgrounds. So here's the strategic plan that we developed that ended, last December. The goals that are listed up front are still the primary goals that are listed in the HUD continuum, and we go all to performance measures. Laura, I don't know if you want to kind of just briefly say how well we've been doing in regard to these measures, just not go into great detail, but just briefly overall comments.
Sure. The very short version is we're doing a lot better. I don't have, exact numbers in front of me right now, but this CoC performance is kind of strange in that it collects performance measurements like a year behind. So I do have some numbers for the newer system performance measures. And we've seen much better numbers. Also, our point in time, which we were hit really hard with increases in our numbers, and that caused us to have really low marks on our, like for instance, our point in time, some of our HMIS type stuff, and those numbers are down this year for the point in time. I don't have them finalized yet. That happens at the end of the month, but a lot of these indicators that we were hit really hard on are improving. The other one that's very important is we've seen, and it's, let me see if I can find it real quick. It was sent out in the notes for the meeting, but the participation with HMIS has increased greatly. And we will be in a much better place with participation rates this year. And I've got like 5 stacks of paper on my desk right here, and I don't see that one right off, but it is in the notes that were sent out for this meeting. So can entertain specific questions.
So overall, through our work groups, we have made progress in regard to these measures. We have shown improvements, and a lot of it has done to our emphasis in regard to the street outreach, the refinements in the point in time count, to our partnership in the Winchester northern area, the participation of the rescue mission in regard to HMIS has been a big plus. Also, the involvement of the Salvation Armies have been a big plus in regard to getting our HMIS numbers up. We still have work to do with a number of these objectives, and I think it's probably important that we kind of keep these as our clear goals. Update these as HUD update these, but continue to have these as one of our top goals within our CoC. Is there any comments or discussion in regard to goal number 1? Okay, you want to scroll down just a little bit, Vine, and look at goal number 2 real quick. And this really kind of focus on transition to permanent housing, or work toward establishing our street outreach activities. Katie and Nikki, I don't know if you all looked at these a whole lot in regard to our street outreach efforts, but do you all have any comments to say where we at, or whether you feel like we continue that we need to update these goals and objectives in any way?
Michael, I think the Built for Zero process has really moved a lot of this forward, and I think that maybe incorporating some more specific language about Built for Zero into this as we kind of recalibrate this would be useful, because I think it has been the one thing that's been a catalyst for all this outreach work. And it may be the best thing we've done as a CoC in the last 2 years is create that effort. We're seeing a lot of movement because of it. So I just think it may be important to include that in if we do want to update this.
Or do we even keep it? And to some degree, we have achieved this goal. And do we want to even have it maintained is a question I have. But maybe modify to the different goal of regard to the Built for Zero initiative of really increasing housing and expanding the Built for Zero activities, not just for the chronically homeless, but to the families and youth, which is kind of the next level of the Built for Zero. So again, this is a discussion, Any other comments from the group in regard to this objective?
This is my first time seeing this, so if I could give you some comments later, that would be great.
Okay.
Okay. Michael, I would just like to add to Shannon with the Build for Zero. I'm a little hesitant about, I think it needs to be updated, but taking it off because we haven't got, our goal is this fall. So, to be at zero, I don't know if we'll be at zero, but we've made great strides. And I hate to take it off of our plan until we have at least went past that goal time. I think it needs to be here and foremost in our mind, at least until we reach our goal that we set. Yeah.
So you talking about the objective, the street outreach objective, or you talking about the Built for Zero objective?
I'm talking about the street outreach as it complements the Build for Zero. Yes. Both.
Because the current way the objective is, it does not really reference Built for Zero at all.
Mm-hmm.
It talks about engagement, involvement, and participation, and so the suggestion Shannon had was to include
the Build for Zero. Yes.
And then the other suggestion is to just eliminate this objective because we have established a lot of these activities and really put in a Built for Zero objective that includes how street outreach will be incorporated into it.
It's incredibly encouraging to see how far we've come in such a short period of time. We've achieved most of these goals.
Yes.
Yes.
So, I don't know whether we want to keep this in here.
One thing I will say though is that the way that this is worded, it really focuses on the development of street outreach teams. And as we know, that the funding available for street outreach does not afford teams. So I don't know if maybe what we think about is kind of collaborative teams, how we may want to develop teams that go beyond just kind of the funded grantee agency. If we want to outreach to say, I know other communities engage law enforcement or engage first responders or just, other folks that are outside of the CoC to be part of their teams, or if it could be kind of a cross CoC collaboration somehow. So that's just kind of my first initial reaction to this is how do we develop teams, because that's the best practice, especially when it comes to safety, that go beyond just that grantee agency.
I agree.
Nikki, we might be able to build on some of the momentum we've already, at least in Harrisonburg, seen over the last few months and how we've responded to this related to COVID. I mean, our community place is stepped up in a way that we've not ever had them fully incorporated into that process. We've had more interaction and more alignment with the Open Door Shelter on a very meaningful kind of way more than we've had. So it really was a really good blueprint for us to be able to create something more substantial, and maybe certainly more funding needs to come, but I think there's a lot of pieces already here where we could work with this. But again, I also believe that this is a localized process with an overarching goal, meaning that each community is going to have to figure out what works for it.
And when it comes to our rural communities, from our experience thus far, it's really hard to think about street outreach in the same terms because you don't always have people who are congregating in areas or encampments. People who are unsheltered are really much more spread out. So rather than thinking about kind of a team that goes out and tries to find people, a more effective, maybe cost-effective way of reaching people is to have stronger relationships with other agencies that could refer individuals they know who are unsheltered to the agency that's focused on that. It's kind of a different approach.
BFZ groups have been awesome for that, Nikki, and your folks have been a huge part of that. Is that as we go down the list, there's usually a very substantive discussion about where's this person at, who knows where this person is, can you give me an update? And I think we've been able to do an awful lot by just simply having all that collective knowledge brought together. So maybe redrafting this in a way that just kind of, it's like Street Outreach 2.0, we're moving on to the next level, maybe is the best option for us.
Are we planning to develop a street outreach work group, like as a committee of the CoC? I've tried to bring up, you know, a need to have more discussion on effective street outreach practices and kind of get feedback from the CoC on how you all want us, you know, want to see street outreach being conducted with the Built for Zero initiative, and that really wasn't like the appropriate place for that discussion. So just wondering if that's something the CoC wanted to do, and if there was interest in that.
Yes.
Clearly, that's part of the discussion right now as we go to reviewing our strategic plan. You know, what's going to be our priority for the next, you know, the next 2 years, and we go to, you know, where do we need to make the improvements? We've done a lot in regard to street outreach. We've established it. As you know, we also were able to increase the funding through this VHSP grant to $20,000 to each of the grantees. We also were able to get a VHDA grant for the CoC, which we are allocating funding for that for the street outreach and centralized intake process. So, you know, there is some additional funding that's coming down for the street outreach. Kate, I haven't heard from you from the AOE's perspective. What were your thoughts when we go to street outreach?
Sorry, I'm late. This is Oscar. I apologize for being late. So I would definitely have an interest in having a work group. I think that's appropriate at this time to kind of like what we're doing with the centralized intake, just to have a more of a cohesive manner in which we provide services to the community. So I think it's definitely something that we would need to implement for the CoC.
I think that what Oscar's talking about with the work group is reasonable, but I don't think that's quite what Nikki was looking for. So we had a little bit of discussion before where Nikki's kind of looking more for, if I understood you correctly, is more of a collaborative meeting with the rapid rehousing providers and the some of the other standalone services, so that we can discuss more in depth how those services are going to be pieced together, kind of for a procedure moving forward. And the case conferencing meeting just wasn't quite the place to have that discussion. And so I do think that it's possible for all of those agencies in each region to go ahead and have a meeting related to that. But I do think that an ongoing task force for the street outreach would make perfect sense too. Did I get that quite right, Nikki?
Yeah, I think it's both.
Yeah, that's
you know, we need to do both what Oscar said and what you said.
And there may still be some room within our existing committee structure to work on this as well. I mean, I view this as a best practices kind of discussion. And giving that committee some things to work on would also be positive. So that may be an avenue for carrying this discussion forward as well.
Any other comments? Well, clearly the discussion seems to say that we need to keep the street outreach objective on our strategic plan, that we also want to incorporate the Built for Zero initiative in that, and also take the outreach and the activities to the next level, how policies and procedures relate to that. I'm assuming that, I believe that's what Sally was talking about, Nikki and Sally were talking about in regard to the relationship to the other agencies, in regard to responses to how they access different services. So that definitely sounds like a broad work group. Do we have anyone that's willing to volunteer for leadership on this? Well, none, then we'll assign someone.
I'll do it. I'll do it.
Thank you, Nikki. We can work together on that.
Yeah, we'll co-lead.
Thank you, Nikki. Thank you, Oscar.
Unless we are wrapping it under the best practices committee, in which case, I guess we'll both just join.
Yeah, I think it's a good discussion to see how to move it forward. I don't know, in regard to all the different work. Best practices has not been functioning as well as we would like it to be the last 6 months. So we have to look at that too. It's just stating what is happening at this time. All right, Vine, let's keep moving. We running out of time here. Our next objectives was we reduce the average length of time persons are in the emergency shelter by 10%. 9% of the emergency shelter and permanent support housing remain housed 4 months after program exit. These are kind of consistent with the the 7 performance objectives up above. We see the best practice committee is responsible HMIS person. Thoughts?
I think they're still appropriate. This is Laura, but I would say to maybe change the language a little bit to incorporate the word system performance measures as our benchmark.
Consistent with the new standards. I think that's right.
We had a split decision on this one because I think we were trending downward, and I think the number has gone back up a little bit in this more recent cycle.
Any other thoughts, comments about these? These are very specific to the transition from shelters to permanent housing and reducing permanent housing. Length of stay in shelters. Any of the other shelter providers want to give any comments?
Hey, this is Vicki from the Rescue Mission. I would agree. I think our numbers are definitely trending upward in the past 3 or 4 months. Definitely have a concern that we're going to keep sending that up, but otherwise it looks fine.
Any other comments? So we'll keep these on the objective list and monitor them. Look, and maybe ask best practices committee and the HMIS coordinator. As you all know, Laura has been working on establishing a data and performance committee, and this and best practices are really kind of the 2 committees that target these objectives.
Michael, I would also like to add that in terms of an action step, and maybe this isn't the appropriate place, but maybe it is. All of this is dependent on the availability of affordable housing. The reason why our numbers are not trending the proper direction is we have less units available to us in the community. So I think that somewhere within this plan, if it's not here or somewhere else, we need to also shift our attention towards advocacies related to affordable housing and doing our best to continue to promote increased housing stock.
All right, well, let's keep reviewing, and we'll put that in the parking lot and see where that fits into the strategic plan. You want to scroll on down to are there any other objectives, or I think we almost nearly done with it? No. And this is really our collaboration partnership. Us working together, making sure that we have all of our key partners involved, that we have the correct governance structure, how we working together. this was one of the top goals that we had in our continuum of care in regard to updating our governance structure so that we'll have a level of sustainability. We have made little progress. We haven't made a lot of progress on this. We've had discussions. We've had some linkages. We go to the activities, and we go to redefining the structure. We have looked at how we doing our grant activities to make it more collaborative. But we have not really been able to work on the sustainability of the CoC in regard to its planning and administration activities.
Michael, I wanted to ask, I mean, it's been a couple of years since we were at this place, and I know you have worked pretty hard to try to change the process and adapt our governance structure. I'd be interested to hear your opinion of the viability of this, or the attainability of this, based on your experience and what we've gone through.
I think we're probably closer than we ever been in regard to be able to achieve this goal. I think we have a more effective and recognized relationship with localities and local governance. I think with the COVID-19 pandemic, it's also engaged some of the localities that have not been involved in our CoC participation, and have expressed, I think that they'll be more willing to be involved in the process and be engaged at a level of at the planning and leadership level, I believe. So there's still a lot of work to do. We had worked closely with the city of Harrisburg and Rockham County, and they were willing to be part of a leadership council. We had Brandon from the Northern Shenandoah Valley Regional Commission did outreach with Vine and I to reach out to the members of the Regional Commission in regard to governance, all the administrators, and there were some that were in transition in regard to the CoC and their participation in the governance possibility. We have not been able to, we have, done just an initial introduction with them, but we have not been able to talk to them at, next level of possible governance. But that's really the next phase to be able to move it forward.
Not to add to the parking lot, but kind of echoing what Shannon said, with all of this kind of new involvement and interest among our policymakers and government leaders, I wonder if we as a and I know advocacy is really tricky because all of us, or most of us, are federally funded. I just wonder if there may be room in this coalition to start putting together some kind of specific policy recommendations or requests of things that government can do, especially local governments, to plug holes in kind of our services and in areas of need, such as housing trust funds and other ways of supporting affordable housing or transitional housing and the like.
And that was the entire idea of this whole new different governance structure. Well, they would be kind of very similar to like the regional commission type of model, where they would have an invested stay in the CoC and some level of involvement. And then once you kind of have that policy engagement, the goal was then hopefully that then they would also be willing and open to sharing resources and coordinating resources with the CoC. Other comments?
I believe at some point there was a discussion, maybe it was within the executive committee, about potentially looking into local planning groups, as well as the current committee structure. Is that something that's still going to be explored in the future?
I think we should. I don't know where everybody else stands on that, but I think we should. I think having the separate case conferencing meetings has helped and makes it a little bit easier to address what's going on as close to us, while still keeping those quarterly meetings or regional meetings that we have not had but are wanting to do. I think is a good step. So I think if we continue that way with all of the providers in doing the local planning groups, I think it would be a good way to get some more people involved from our local region who have dropped off when we eliminated those.
Also wanted to add another part that was really kind of enlightening or instructive was the fact that when we were writing the VHSP grant, how difficult it was for us to illustrate how wide we've broadened our circle. I think we were euphemistic at best in some of the things that we listed, and we need to continue to increase our reach. And in some cases, that has to be a localized effort because we've lost a lot of secondary providers. And maybe this Zoom process will bring a lot more people back to the table who couldn't attend a meeting, 80 miles or 30 miles away. So I think there's opportunity here as well.
So I hear a recommendation to add inclusion of local planning groups into this action step or into an action step. So I'm assuming that we'll continue this under the executive committee, this goal.
Yes.
Yeah, I'm not on the executive committee, but yes, I think that we should include it in this action step. That's my opinion here. And I think that there's a possibility for it to be 2 or 3 local planning groups based on the size of our CoC and what makes the most sense for the different areas to have their like I said, there are other local providers there. School liaisons, their social services, all those people who we do not have coming to the big meetings. I recommend that we add it to this action step.
Well, we'll take that into consideration, and the executive committee will then look at the subjective and as part of the activities and update it accordingly. I think that's it, right, for the strategic plan, Ryan? Oh no, we got more? So funding to support housing by 10% as measured by total CoC funding. Oh, we may have done that this year when we go to all activities.
Well, this year, mission accomplished. we got our 10%.
Yep. The question is do we want to keep this?
Michael, I think that we would move a different direction on this. It says here funding increased at or at least 10% from non-local funding. To be perfectly honest with you, I think Sheila made this point earlier, I think we need to continue as a CoC to create capacity at the agency level and at the community level, and that we should be focusing also on strengthening our membership by finding new ways to diversify our funding and then facilitating that and working together collaboratively to share ideas on how we can do that. So I think the focus is more about capacity building amongst our agencies.
Other thoughts, comments?
I definitely agree with Shannon. we need to do some work here to build this capacity and to build partnerships with the community and other agencies and services within our community. And I think we've all had to do that just because we've been forced into it with COVID-19, but you know, we've made these relationships. We want to keep going forward.
So right now, the action steps are that we're going to increase funding from non-government resources and local funding and sources of local funding. We maximize our performance for the funding that we currently receive, which is the state and federal funding.
Mm-hmm.
We offer technical assistance to our members in regard to access and funding to CoC sources or beyond CoC sources. And then we assist our CoC members by accessing funding by offering training. So I think what's there is what Shannon just said. Is there something else that we want to add? Unless I missed it. Any other comments? So we want to continue this one?
Yes.
Yeah.
Okay. Data participation, Laura gave a brief update that we have increased our participation. This is an ongoing process. Probably the biggest challenge that I hear from Laura is staff turnover, transition of staff, and then loss of data and changes in regard to training and getting agencies back up.
Michael, if I can jump in real quick, I do have those numbers ready now. The increase in HMIS coverage, and this is with a huge thanks, as you had mentioned earlier, to Winchester Rescue Mission. They are backfilling some of their data so we can count them this year during the point in time count as HMIS providers on our HIC, our housing inventory chart. But with their participation and Salvation Army and Family Promise stepping in and participating, we have gone from 13% adult year-round beds to 62% coverage, which is huge. Also, the families have increased from 57% to 85%. We still do not have Watts and do not have Salvation Army Winchester participating, but unless I'm skipping somebody, but what comes to mind right now, those are the only two that are not participating, that are non-domestic violence providers.
Lola, I'm assuming that you probably want to keep this objective and have this continue work with your data and performance committee?
Oh, 100%. And I have great hope with this, the dashboard that Andrea's working to put together. If that's finally gelling together, we'll have a lot of new tools to work with. So I'm very excited about getting the data committee running. And hey, let me just throw this out here. If you're interested, send me an email.
We always like marketing opportunities. Alrighty. And then this objective really kind of talks to our media and marketing advocacy committee.
I think we had come up with new action steps. I'm not sure if you have them available, Vine, but I think we had talked on our last meeting about it, and we had come up with the action steps for that. We still kind of want to keep the objective on the same but there was some changes, I believe, to some of the action steps.
Yes, those are in the last minutes that the Media and Advocacy Committee had, and I will be incorporating those updates.
So the one parking lot item that Nikki posted in regard to the advocacy issue, CoC advocacy issue, do we want to add that as an action step here in this objective? As you all update these objectives?
Can someone repeat that? I don't know if I was here for that. Sorry.
I'd say it was around engaging our policymakers and government leaders in policy opportunities, I could say, to close gaps in services or close gaps in needs, to use advocacy as a way of getting our local governments to create the systems or the kind of policy environment that allows us to better serve, better meet our goals, something like that.
Okay. So would it be engaging local government participation or something like that? I think we need to engage first and then talk about all the gaps in, needs in our community.
Yeah.
So
Engage
maybe
local
that,
government and identify policy and system opportunities.
I think that's good.
Oscar, have we done the create and implement a CoC partner satisfaction survey? Has that been done yet?
There is a draft, and I believe that Vine created one on SurveyMonkey, I believe. She helped us do that. We just need to finalize it. The Media Advocacy Committee hasn't met since, I believe, February or January. So if we can plan to meet next month so we can go over some of those things. There was a lot of literature that was also that we were working on to provide more information to the community partners about what the CoC does. So I think it's a perfect opportunity for us to get those done and also engage local government, to just inform them of what the CoC actually does.
Well, the reason I brought it up, it seems that, and maybe you all are not having this problem in other areas, but we seem to go backwards a little bit on our participation with the Department of Social Services, which is a government agency. And the latest thing is now they don't want to give verification of homelessness from their clients. So I'm wondering if anybody else is having that problem, and if they're gonna cut, that's a first step in cutting many other communications. If they have a client coming in for services and they know they're homeless, I mean, that's pretty important that they send us that third-party verification of that. And I've been on the north end at our case conferencing. I mean, every month I make an effort to invite them, and we're not getting anybody at the table. And I'm really worried that I don't know if you all have that problem on the south, but we just don't have any participation from the Department of Social Services.
So for Frederick County and Winchester City, Department of Social Services, I don't think we've ever had an issue with them providing verification or even documentation if the clients don't have like IDs or socials or stuff like that. They're usually pretty good about providing documentation to make sure that clients get services. But I mean, I don't think they are showing up to the case conferencing. I can ask maybe Mandy or Cheryl to reach out to them and see if we can get them at the table.
Yeah, maybe if we could find a really good advocate at one Department of Social Services to communicate with the other Department of Services within our CoC, maybe that's a way to get them more involved. But that concerns me that they're already not wanting to do that or coming to the table for the meetings.
Clearly, let's put that on our parking lot too, as something we need to follow up on in regard to how we engage and maintain our partnerships with our providers, and then come up with specific strategies. So we definitely want to keep this objective, it sounds like, in regard to increasing and improving our internal and external communication. Clearly, it's a communication issue and clarification, and also making sure that there's a joint understanding of how everyone benefits from working together. So Oscar, can you add that as another one of the action steps, and we go to maybe kind of talk about some specific activities that we would do in regard to improving those relationships and partnerships? Did I scare you away, Oscar?
No, I was trying to push the space button to speak, but I guess it didn't work. Yeah, we can definitely do that.
Thank you. The only other parking lot issue that we did not address during this review of the objectives is that expansion of affordable housing issue. Clearly, there's a need for that. I don't know where to put it exactly, but let's keep talking, and then maybe we'll think about where best to put that under objectives.
I wanted to, if it's all right, kind of move us in terms of
yes, to the
what I share. Yes, and
yep.
So I believe a lot of what is under the CoC NOFA debriefing, and I shared that as well, so hopefully you all have been able to look through, but the final page that summarizes our score as a CoC had some of these key points as the areas where we lost the most points. And so we've discussed a number of them in terms of systems performance measures and HMIS. I just wanted to also point to job and income growth was another area, and then addressing racial disparities. I felt like that was interesting that was included in the NOFA for the first time last year, and given the context of all that's going on, it's going to make a comeback.
Well, the one measure that certainly hurt us was the growth of income. However, the majority of our NOFA served cases are in permanent supportive housing, and it's a really tough area to show income growth. So that data was not really very friendly to us, and I think we suffer from the fact that we're not very diversified in the work that we do within the NOFA. We largely fund permanent supportive housing with it. Those numbers would look very differently if we had included rapid rehousing in that process or other programs. And so that's going to always be a real difficult one for us to be able to address.
I mean, we try with the centralized intake, so, but maybe we can go at it again to increase the centralized intake. I mean, maybe we can work together and see what, where can we, you know, where can we do better in presenting this grant to fund or increase presence of centralized intake.
probably, you know, we do have work groups that address a number of these issues other than the job income growth, like Shannon says, is a little bit of a challenge. I know Chris works with his staff in regard to making sure everyone gets services and increases benefit access. I guess addressing racial disparities is one that I think it kind of behooves. Last year, Laura did data analysis that showed that there was a desperate impact within our CoC in regard to racial disparities. And so with what's going on at this time, I feel like we should, or I recommend that we establish a work group or committee to look at this issue and see how, or if there's anything that within the CoC as a continuum that we can be able to put forward and address. Many of the issues of racial disparities are out of control, but those things that are all within our control, we should be able to look at and see how we can be able to address those. At the same time, there may be some models from other CoCs that have put forth some efforts in regard to this issue.
That seems like it would be a good task for the best practices committee, if not another committee, like another new committee.
Other people's thoughts.
Michael, when Von and I and several of us had a meeting earlier with compliance and evaluation, and we were talking about the income. I know that you know, within this is Northwestern, and I know that Chris and the team at Northwestern have worked much harder. They had a program that was totally funded, and they've moved away from that the clients take more responsibility. I think what we were seeing though in the application is that we're not really seeing that progression that Northwestern definitely made. Chris, do you agree with that? Is there not a place to focus on that growth in the NOVA, or?
My thought is every year the clients get a percentage of a raise in their Social Security, those who get you know, SSI benefits. But we also have some people who have, you know, obtained jobs during the year. So we're trying to reflect that in our HMIS data.
Okay.
Yeah, and I wanted to point out, I think we suffer greatly from skewed data. So if Northwest has a huge increase in the number of people in their PSH program that are maximizing income, we're going to see an exponential growth. If they don't, we're not going to see any change. And I don't think that is necessarily indicative of the work that Northwest is doing one way or the other. Again, when the majority of your data is coming from a permanent supportive housing environment where you're housing the most vulnerable people with disabilities and mental health challenges, you're not going to see a tremendous amount of growth in income, particularly from employment income. So it makes it very difficult for us to be able to make this a much better measure. And we're drawing from a very small pool of data here. As to the racial disparity issue, I think it continues to be an issue that we need to look at in terms of, particularly in terms of access for services. I believe, Laura, and please correct me, that our data from the racial disparity data was actually pretty positive as it related to services. Now, we had racial disparity in the number of people experiencing homelessness, which is a societal and broader issue that we need to be very much attuned to. But as a community, we did a pretty good job responding to that in relation to the data that we showed last year. I don't know if the new data would show the same, but I was fairly pleased with the fact that we had responded in a way that certainly showed that we've done our best to try to address those needs.
I would agree with that. Across the board, we, you know, if there was a disparity, and there definitely was a disparity with people of color and different ethnicities in different ways. And in each example, it showed that we served that same percentage of persons, you know, the base amount or greater, which was really good to see. And honestly, I think we saw that. We were like, oh, it looks like we're doing okay with access. And we kind of went on to things. It was more of a check. So I think that maybe it's correct in looking at things and making sure that there's equal access and setting up some policies if there are some that make sense.
And again, I think we're impacted here also by the fact that we're working with a very small program with our PSH that's where the data is being drawn from. So if the units don't roll over and people of color don't get opportunities to go into those units, our numbers are not going to improve. And again, I don't believe that that's Northwest's doing in any way. It's simply a consequence of how we fund and what we choose to fund and what that data looks like. And we may, in some cases, have to find new ways to address this. But at the end of the day, I do not put any of the onus on this on Northwest for the types of people that they're serving.
Right. We haven't lost a single person in the last year, and we typically, you know, don't have openings from year to year.
And we're talking about this strategically. Again, I don't want us to look specifically programmatic or just at the CoC NOFA or the federal grant, but these were comments that we got from the CoC grant, like the below DHCD, VHSP grant. And we want to look at it as a CoC as a whole, as a system. And how are we doing in regard to addressing racial disparity? Do we have policies in place that we feel like are effective that allow for access consistent with what all we feel as a CoC? And so, you know, and that's the question to the group in regard to, do we need to put this as a goal, or do we look at this and just move on? And if we have a goal, then we have to have a plan, and we have to have a work group or someone responsible or some committee responsible for developing around those goals and objectives.
Michael, I would submit that it's probably an agenda item for our centralized intake work group to look at, and we have to figure out some ways to develop some data. Prior to all of this happening, I attended a session talking about racial bias and how it's built into the VI SPDAT, how it's not culturally competent and that there's issues there and that it's a barrier. We need to look at how our phone-based system impacts people. It's a broader discussion, and it's certainly a finer points discussion in the midst of a lot of other crises, but I think it's an ongoing discussion we need to have, particularly as it relates to access. So I would certainly say that at least at the centralized intake and coordinated entry level, we need to look at this.
Other comments?
I think it needs to be a goal. We know that we're not scoring well there. It's not something that we need to develop action steps forward, like Shannon said, and move forward. We can't just set it to the side. I don't believe we shouldn't.
And I think it's not just when you're talking about race, okay? I think to me, it also would be inclusive of like gender also, you know, what, because sometimes that's included within that group too. You know, it's in almost any disparity that's like that, you know, race, gender, religion, whatever.
Sexuality, yeah.
Well, I will say there is an anti-discrimination policy that I had worked on last time last year, and it includes, you know, race, gender, sexuality, religious beliefs, ethnicity, all that. Just because of the context of what's going on socially, politically, the race aspect is being highlighted. Not to say the other aspects aren't important. We do have that anti-discrimination policy that covers everything. But we're just wondering at this time, because of all that's going on in the context and the fact that this has been highlighted since last year's NOFA, it might need to be further developed. And like Sheila had said, it be a goal in our strategic plan. Shannon's talked about it being, you know, a CI work group agenda item. It might also be something that as a COC, it's focused on a bit more in terms of policies that agencies have, and as a COC as well. So that's, I think that those are some different aspects to this.
Other comments? So we'll add it as a goal, Helen, and then we'll definitely look at it when we go to centralized intake and overall policies. So I don't know whether it should go under CI or executive committee at this time, but it may be under both of those when we go to responsibilities.
Michael, I would only say that maybe it needs to start probably at the exec level, because I think we have to have, when you have a goal, you have to have a measurable outcome. And I think we need to understand this from a data collection standpoint, what this would look like, and provide some clear action steps to those that are doing the coordinated entry work, because we have to have some guidelines and some things that come out of this. I mean, I believe that we as a COC have pretty strong policies in most of our agencies to address these issues. And again, the disparity numbers that we examined last year were actually very positive in terms of the fact that we were providing services equitably, and in some cases we actually overrepresented some populations that were vulnerable. So I'm very pleased with the work we've done so far. So it's not so much a local problem that we are reacting to bad data. This has a lot to do with the fact that we are submitting data from a very small program in a community that is probably largely Anglo, and we need to figure out ways to look at how that workflow is coming and how we refer to personal or permanent supportive housing, and whether there's any racial bias in that process.
I agree, but I think also that it was part of the VHSP grant. There was a questions asked about that, and within that, and we go to how we address racial disparities. So it's, you know, it is coming into not just the COC, but to all the grants that we have, state and federal. Okay. So we talked about DHCD also had requirements for us when we go to our grant application. And these were action steps that they wanted us to respond to. How we address gaps in assessment and outreach. The use of law enforcement for referrals. Updating and providing detail on prioritization process for all services. And building connections with non-VSSP providers in the community. To some degree, a number of our goals that we've talked about in our strategic plan has those embedded with them. The connections with the non-VSP providers in the community. But the other three have a little bit less of a activity. So let's talk first about the strategy on assessment and outreach created by managing such a wide service area. As we earlier talked, we had in our strategic plan the street outreach, and that we were going to revise that component or that objective to incorporate the Built for Zero activities. I guess in my mind, this is kind of consistent with that objective, and that we can incorporate that into that action steps. What are other people's thoughts?
Michael, since I'm fairly familiar with the grant and how it was put together, I think that this was a response to our statement that we have a very wide and far-flung and largely rural community that we serve. And I think that the discussion is more about how do we address someone in Stanley out in Page County, or how do we reach people that are in rural communities that may not necessarily access our services currently in ways that we haven't before.
So do you see again that this strategy is beyond that, and or do you recommend it be a separate action step or goal to be able to address this?
I don't think so. I think it kind of goes in with the first one that you were talking about. With the street outreach, I believe.
Other people's thoughts? It's either through street outreach or shelters, I'm assuming, because that's where we only have the service providers in those local areas.
Right.
If we don't go through them, then who else could we go through at this time? Any other comments? I think I'm losing you guys. It's 11:47. You know, starting to die on me. All right, this again, all these issues, action steps, all came from the grant. These were comments that that we brought up as concerns or issues, or how we do certain operations. They did have a concern that we put in the grant that we utilize law enforcement for referrals. In some communities, that becomes a barrier for clients because they run from law enforcement. And try to avoid law enforcement. How is this, where do we respond, or how do we come up with a strategy to be able to address the statement or action step?
Well, would you not need someone from law enforcement to be sitting at the table to give you insight? I mean, to understand the challenges that they may face. I think to me anyway, you don't have anyone from law enforcement at the table. And so I think, you need to have that also.
I agree. Definitely when we come up with strategies in regard to how we can take referrals from law enforcement, we're going to have to incorporate law enforcement into the work group and get their opinions and how we can be able to work together to be able to address that access issue. This is kind of a centralized intake.
So actually, Michael, I asked Will for clarification on this when this point was brought up in the meeting. And my understanding with speaking to Will was that he was just saying that when law enforcement is involved in making referrals, there is the possibility of it creating a barrier to access. However, he was just saying we needed to take a look at that to confirm that it's not creating a barrier to the access of our services. And what I think our response here needs to be is that we are not requiring that people go through law enforcement to access our services. So there is no barrier there. It's just that we partner with law enforcement to make some referrals as necessary. However, people do not need to go through law enforcement to access the services that we're providing.
But do we partnership? I mean, what partnership do we have with law enforcement?
It's actually the way that the grant was written is they were asking questions about our ability to provide 24-hour responsiveness to services. And generally, when we get calls for service outside of our normal workday, it's law enforcement who has picked up somebody that has nowhere to go, and they're looking for resources. And so we talked about that as a need for us as a community to be able to figure out how, when we operate a coordinated entry that does not operate 24 hours a day, how are we able to provide services and direct people in a proper way to the appropriate services on an emergency basis? And law enforcement was discussed as an example of that. So I think Shelley's point was correct. Will came back and thought that there was a possibility that we may have been using law enforcement as an avenue for referrals, which is not the case.
And Michael, just to add to Shannon here at Shenandoah Alliance, the law enforcement, it's not required they go, but the law enforcement on the weekends, if there's someone that's homeless that needs shelter, they're authorized through a community fund that the churches have set up to actually place them in shelter, and then they call, Monday morning on business hours. So that's been very helpful. It's definitely not a barrier. It's getting them into shelter, and then we're providing services on Monday going forward of how we can help. So, I'd hate for us to lose that relationship with law enforcement, because it's been very helpful and supplements our services very well.
In Harrisonburg, the local 911 dispatch center and all of the emergency response people actually have my personal cell phone number. So I get calls when we have families over the weekend that cannot get into shelter. So we were trying to address how we can be responsive as a coordinated entry 24 hours a day, and finding new strategies and ways to be able to do that. And that was really the thrust of how this even came up within the grant.
Will also said, this was really more a point for you all just to take a look at and consider. It's not to say that it is creating a barrier.
My understanding is that we do have to respond to these action steps, though, some type of statement or action, and we have to respond from a CoC perspective. So I'm open to you guys writing up in regard to how y'all utilize law enforcement for the referrals process, and then we can include that with it. If we don't need to have a workforce or task force to address this, then I'm good with that too. Because if it sounds like that it's just more of a referral process versus a issue of them, that's not the only primary option that individuals have. And that would probably be the concern. If that was the only way that people could access services was through law enforcement, that could be a problem. So what we all, Sally and Sheila, if y'all can get together and write up what y'all were saying in regard to that response, then we can move forward with that and not have to do any alternative activities, unless you all feel like that's the only option they do have is just through law enforcement, which may be a barrier, I don't know.
Well, I guess we need to hear from the others. I don't think there are, but are there any services that is requiring that the potential client goes through the law enforcement before entering into a shelter? It sounds like we don't have that in our CoC, so our answer would suffice.
Yeah, for the Winchester, Frederick County area, we don't have anything like that. So, I mean, we do get people that are occasionally, they call us about services, but they're not required to go through, 911 or law enforcement to have access to services.
I do believe that the Salvation Armies do have people run a quick background check before admittance.
Well, I am almost 100% positive that Shannon didn't write that in the grant.
No, we did not. Our Salvation Army in Harrisonburg does have a process where people have to go to the police department first and go through a background check. They're a high barrier, and that's why they're not a funded partner in our continuum right now.
Mm-hmm.
Okay, we got a plan for this law enforcement. Yeah, it's just it's not a. I agree. I don't think this is. We just need to respond to it. Prioritization process for all areas of service. CoC wide. This is a big one. Thoughts? Go ahead.
Yeah, we have a tool. I think, like Katie was just saying, it definitely needs to be updated, and it's not. I don't think it's the best that we can do, but there is a tool in place. So I think it's something we need to work on and give to best practice, you know, to improve. Recommendations need to be made to the best practice. Yeah. We need some work done there.
Yeah.
Again, the grant response acknowledged the fact that we had been using a tool that was developed in 2016, that we had incorporated the VI SPDAT into our process, and that we were in the process of trying to incorporate Built for Zero and prioritizing the most vulnerable in our community for services, and that we were going to have to continue to adapt and change is how we look at the community that we work with. And so I think that actually we probably scored pretty well in this area, which we did in this particular section of the grant, because of the fact that we're showing adaptability. We have to continue to provide more detail in this area, and it's a moving target. So we as a CoC need to work on this at a committee level and continue to work on it.
This is kind of driven by service provider versus all committees that we currently operate under. Shelter prevention, rapid rehousing, permanent support housing. So it, to some degree, it kind of lends that the shelter providers, prevention providers, the rapid rehousing providers, the permanent support housing providers get together, and then they come up with some proposals and go to prioritization processes reflected of the agencies and CoC-wide. I don't think this falls into any specific one committee that we currently have in operation, and probably is a separate goal and action steps for each of these service providers. Other people thoughts?
Well, I think if we develop a prioritization tool and a process that all agencies, and it's voted on within the CoC and adapted within the CoC, that all service providers should be using it.
I agree.
Because that's our gray area. We need everything to be standardized, and we all need to be using the same tools.
I want to be clear that this comes into play when we run out of money, when we don't have enough resources. The guidelines of the actual programs that we administer are very clear, and they are set forth by the DHCD, and we follow those particular standards. The issue comes down to who are we trying to target in terms of if we have a scarcity of resources, and how do we prioritize those individuals. And we did have a process in place, and again, it's a process that I don't think fits our reality today. So we can either address this as a grantee work group, or we can work on this through the centralized intake process. But I will tell you, I do believe that it's something that requires or should have the input and understanding of non-provider agencies who are referring to our agencies. So we all understand where we're on the same page, and we all are speaking out on what populations we need to be prioritizing.
So we know it's a goal. We know it's a priority. We know that we need to have this one done. And just kind of thinking about how we can, who's responsible and how, you know, which committee would be responsible. We establish separate committees for this.
I think it might be better if we do as a VHSP grantees, just so that we're all on the same page. I think just having a meeting to come up with a tool that all the agencies will use, I think would be beneficial.
So y'all believe that we can come up with one tool or one process that will meet all this with a shelter prevention, rehousing, permanent support housing?
Yes.
Okay. So who's responsible?
The whole CoC. Maybe we have to start at the executive level. And like Oscar said, all grantees need to be there. And like Shannon's point is, once we decide this, we need a buy-in from all the agencies that are referring, so they understand the process.
And I want to be, again, very clear about this, and there may be some differences of opinion out there, but there's a reason why we scored first on our grant in this overall response that we provided to DHCD. This is not a train wreck. We don't have loosey-goosey processes and a lack of priority already. We have a fair process. It could be improved, and it needs to adapt. So I do think that we as a provider community can certainly begin having this discussion. And maybe we create a document that is then submitted to the broader CoC for discussion and comment. That might be the easiest way to do that. And again, we just have to convene some sort of grantee discussion. And again, I think that should be led by the CoC coordinator or someone from the lead agency to be able to kind of facilitate and keep that on track.
Other comments, feedback? Okay, we'll move this to executive committee and then make a decision and go to how we can move this one forward. But I believe Emily told me that we had to respond by the end of this fiscal year. So we have some time to be able to move forward on these strategies and activities. So we have a year to be able to come up with plans and action steps. But time goes fast. So it's important that we kind of stay on top of this and keep moving it forward. Okay, we are at all time, we're past all time. I wish we had time for updates when we go to homelessness and housing initiatives, but I do want to be respectful of everyone's time. I'm sorry that we carried this discussion too far. I do want to make one announcement though before we adjourn. And I do want to thank Vine Adawai for her work during this last year as a CoC coordinator. Many of you all saw the notice that Vine will be leaving us to move to Dallas, Texas, and be with her family. So she'll be sorely missed in regard to her work, and I would ask that the whole group give her a round of thanks and appreciation for everything that she's done during this last year. A lot of work in regard to updating on policies. The second thing is upon notice of the her resignation, I put in for job description, or application process. We have about 35 applicants at this time in the queue. So we will be finalizing, going through the screening and interviewing process the week of the 22nd. So we hope to be able to, Vine's last day is July 5th. So we hope to be able to have that position filled sometime, July 5th. And so, which is a Sunday, but we hope to have that whole position filled in the middle of July sometime.
Michael, will there be an opportunity for the CoC as a general body to be able to participate in that process at all? It's going to be an HRHA internal hire.
I was going to try to move it fast and do a HOHA focus. If someone wants to be involved, I'll be happy to have anyone included in the process. So if you do want to be involved, you just let me know. I do want to be very efficient in regard to making it happen because we got a lot of work to do, and the federal NOFA grants be coming out here very shortly, and so we need to have this position filled. All right, thank you all. Everyone have a great day. I appreciate everyone's attendance and everyone's input. We got a lot of work ahead as we move forward and we go to the CoC. And it's good to see y'all. Take care.
Thank you.
Bye.
Bye.
Bye-bye.
Thank you, Vine.
Thank you, Vine.
We're going to miss you.
We'll miss
Bye.
you.
Yes, wish you the
Thank
best,
you, Vine.
Vine.